everyone. I'm Morgan Tracy, one of the perinatal nurse navigators here at Wesley. And today I have with me Dr. Matt Smith. He's one of our anesthesiologists with our dedicated anesthesia group who works with our labor and delivery and birth care suites.
Hey,
Welcome. Yes.
thanks for
Hey,
having me.
you're welcome. One of the things women often fear is epidurals and just wondering about the process and how that works. Would you mind explaining the process of getting an epidural to us?
Yeah. So, first, when I enter the room, there's usually a kind of greeting time where we say hello, introduce each other, and go over any questions or concerns that patients may have. So we like to just kind of talk about the epidural and what we're going to do first and foremost. And then there's usually a couple of minutes of just setting up some equipment, drawing up some medications, um, and we'll have the patient sit up on the bed. Um, After that, there's the first thing that the patient will experience is having their back cleaned off with some cleaning solution. And then a plastic drape is applied to the patient's back. Um, the first injection that we do is usually with lidocaine or local anesthetic to numb up the skin, which helps the rest of the procedure go more smoothly and more comfortable for the patient.
Would you say that's probably the most painful part?
That is typically the most painful. Usually, we usually describe this to patients as being a poke followed by 15 to 20 seconds of stinging and burning. Feels kind of like a bee sting. After that, the rest of the procedure typically isn't so bad. Um, it is normal for patients to experience some deep or sometimes kind of intense pressure through the rest of the procedure, but it shouldn't really be sharp or painful. If that is something that you're experiencing, you can always let us know. We can give more of that local anesthetic or numbing medicine, or adjust our technique to help it be more comfortable for you.
And this is something you're going to be talking through with the patient as you're doing things,
Yeah,
correct?
definitely. We try to describe everything and explain it to the patient as we're doing it, or preferably a little bit before we do it, just so that we're minimizing any surprises to the patient.
Perfect. Yeah, no surprises is good. Once they get that first dose of medicine, how long does it typically take for that epidural to start working or for them to notice a difference?
Yeah, so once we start administering medications to the patient, we usually explain that there's a 15 to 20-minute waiting period while those medications are taking effect. It's normal throughout this period that you may start experiencing some relief from the pain of contractions, but we usually expect that full effect by 20 to 25 minutes.
Okay. So maybe don't wait till the very last second to get the epidural if
Correct.
you're planning on getting an
Yes.
epidural. Gotcha. Um, One of the things with that, I mean, I found it sounds like you help ease fears by explaining what you're doing as you go. How else would you help women who are concerned or have asked for the epidural,
Yeah.
but then are like, I don't know
Yeah.
what am I doing?
I find that that's the most helpful part is just talking it over beforehand. Occasionally we'll get patients coming through who think that they would like an epidural, but really they're just kind of concerned about what they've heard or friends' experiences or something like that. Um, so if that's something that we can talk through ahead of time,
Mhm.
that's usually the most helpful. If you have any questions, we're always happy to answer them. We can come by and see you beforehand, even if you don't want the epidural right now. We're always happy to come see you and answer any questions. And then just being um, friendly, confident,
Yeah.
making the situation as comfortable as we can for you, walking you through all the steps as we go. All of that typically helps relieve patients' concerns.
Yeah, I feel like one of the things that definitely helps is that you guys are dedicated to labor and delivery and birth care suites while you're here. And so what that means for you guys is that they're not coming from some random gallbladder surgery to come put in your epidural. When they are here, they are doing epidurals 24/7 and emergency medicine as needed. So you know that who is walking in your room knows what they're doing. And I think that helps ease many fears, knowing that this is something you guys are here to do
Yeah, definitely.
24/7. So, now there's a difference between like a labor epidural and then say we have a scheduled C-section. Can you talk a little
Sure.
bit to those differences and
Yeah,
what to expect with that?
so when we're doing epidurals for a patient who's laboring, we use a little bit of a different strategy. So the medications that we give for a laboring patient tend to be the way we talk about it is a weaker concentration of medicine. So it's not as strong a medication. This helps take away the pain of labor and helps ease the contractions while still allowing patients the ability to, say, move their legs, feel some pressure with contractions. they're able to assist with pushing during delivery if they would like to do that. Certain circumstances warrant that we do give stronger medications to help cover usually the later stages of labor as that stimulation gets more intense, stronger, more frequent. It is normal that sometimes we have to give stronger medications to help cover that painful stimulus. Um, Sometimes during that process, the legs can become heavier, weaker. You may not be able to move them as well. That's all part of the normal labor epidural process. And when we have scheduled C-sections, we use stronger medications from the get-go. So typically the procedure that we're doing for a C-section is called a combined spinal and epidural. That means that we're actually doing a spinal injection first while also placing an epidural catheter. The epidural catheter there allows us to um, give more medication later on if we need to supplement that spinal injection at all, just to help keep patients comfortable without having to use sedating medications and things like that.
Yeah.
Um, this procedure typically takes 10 minutes with about 10 to 15 minutes to get the patient comfortable enough to the point that they're ready to have a C-section. Um, so it is a little quicker in onset. Um, we'll usually hear that from patients that when they have a scheduled C-section compared to maybe a previous labor experience, that the block sets up a lot faster and they
Mhm.
feel themselves getting number a lot faster. We do also, probably one of the biggest differences to patients is that um, we usually aim to get that level of numbness a little bit higher. So patients will experience being numb, say, from mid-chest and down, whereas with a labor epidural, we don't need that numbness to go quite as high. Sometimes this can actually um, change the way patients perceive their breathing, and they might say, oh, it feels like my chest is heavy. That's normal. If you're experiencing things like that, always talk it over with your anesthesiologist, and we'll be happy to
Yeah.
walk you through that process.
Well, and the beauty of a C-section also is that you or a CRNA are by the head of the bed at all times to talk you through what's normal. That's who you tell if there's anything going on that you're like, is this normal? Is this normal? We're watching your vital signs. We're watching everything. So you're not alone up there. You have
Yep,
a team
we're there
member.
with you the whole time.
Yeah, the whole time. Can you talk a little bit to our enhanced surgical recovery process
Yeah, so
from the anesthesia side of
yeah,
things?
we use a couple of unique things that are in place in our protocols to help you have the best experience possible if you have to have a C-section. Several of those things are oral medications that you can take beforehand or possibly IV medications. These help control pain and minimize nausea or chances of a complication called aspiration. So just things to help keep the patient safer. Um, there are other strategies that we use regarding our fluid management to help reduce the overall amount of fluids administered to patients, which helps cut down on other complications. It also involves temperature management techniques to help keep patients within a comfortable temperature range, make sure that patients aren't um, becoming too cold or febrile or
Yeah.
anything like that. And then um, one of the biggest one of the biggest changes that comes along with this enhanced recovery protocol is the use of what we call TAP blocks. This stands for transversus abdominis plane blocks. It's a kind of peripheral nerve block that we can do, an injection in either side of the abdomen um, of local anesthetic. We usually use bupivacaine, and we're able to numb up essentially the abdominal wall and cover the incision site for about 15 to 24 hours.
Yeah.
It varies by patient and how much medication we're able to use.
And this tap block's typically placed while they still have the effects of that spinal
Mhm.
epidural, so they don't feel that
Yeah,
being placed, but it does help with that recovery and keep that incisional pain down. Is
yeah.
that?
So the spinal that patients
Mhm.
receive for C-sections, that only lasts about 2 to 3 hours or so. So after that, the effects of the spinal have worn off. But this tap block, we're able to get nearly a day's worth of pain control out of this block, which helps minimize the amount of oral pain medications and narcotic pain medications that patients typically would take to help stay comfortable after a C-section.
Nice. Well, what What is your favorite part of your job? I think that's
Uh,
something that's always good to
well,
know.
it'd be two things. I love the procedures. I love working with needles. I think it's interesting. I like that. Maybe I'm a weirdo.
Uh,
Um,
or medical.
so I really like the procedural aspect. Um, Probably one of the parts that I enjoy seeing the most of my day-to-day work is just seeing the relief that patients get. One, from being comfortable during labor, but also we were talking about concerns that patients have in getting epidurals. I do enjoy talking through this process with patients and helping them become more comfortable in that regard too, kind of being able to alleviate some of those fears and concerns that they have, seeing them become more comfortable with the labor process, and then just seeing that physical relief that they get from their labor pains throughout this process. That's
Yeah.
really gratifying to me. It's an immediate reward for my
Right.
work typically, which it's a nice feeling. I like filling that role in the medical field.
I know we sometimes call anesthesia our knights in shining armor because they come and take all the pain away. So, yeah, thank you so much for chatting with us today. I appreciate your knowledge, and I hope that helps everybody feel a little bit more comfortable with the epidural process here at Wesley.
Thank you.